Welcome to the Healthy Perspective Podcast with your host, chiropractor, entrepreneur, mentor, and author, Dr. Chris Bowman. He'll break down and extract the secret sauce behind his own success and the success of some of the top leaders in every category and from around the world. Get ready for your weekly mental adjustment because shift is going to happen.
Hello, everyone. Thank you so much for joining me for another episode of the Healthy Perspective Podcast. Today, we have Dr. David. He is a doctor of a franchise office for TMJ and sleep therapy centers. He is in Thousand Oaks, LA area, and we've been having a bit of a conversation off screen. And I can tell you, this is going to be a very enlightening talk and potentially life-saving talk. I mean, as a chiropractor, I see a lot of kids. Obviously, we see a lot of chronic stuff. If you know me as well, and TMJ, sleep issues, sleep apnea is all the time, almost every time related to the emotional stuff that I'm seeing as well. Whether it's anxiety or inflammation or chronic disease, these things are all working hand in hand. And very rarely do I get to speak with somebody that is actually looking at the body as a whole and looking at the problem as not just a symptom that needs to be diminished, but a functional deficiency that needs to be looked at differently, and manual therapy needs to happen in order to bring ease back to the body. So for anyone listening that or knows somebody that has TMJ, sleep issues, anxiety, listen up. This is going to be a powerful one. Dr. David, thank you so much for joining me.
Oh my God, such a pleasure. And like you said, our off the recording conversation was we were just getting so worked up. It was so great how we are so like-minded. So I love it. I can't wait to talk to you about what I do.
Yeah. Well, why don't you just kind of start from the beginning? When you wanted to go to medical school, you wanted to, pursue a higher degree. What was kind of the mindset, the vision, and how did that kind of work into what you're doing today?
So everyone in my family is like a doctor or dentist, right?
Okay.
I never wanted to be a physician because their patients die on them. And I didn't think I could emotionally handle that. I'm just being very candid. When I was 18, I had a cold. And my mom, being a neurotic Jewish mother, sent me to the doctor, right? And I went to Kaiser, and there is a waiting room filled with people hacking and coughing. So I left. I came back an hour later. They brought me in, and they prescribed antibiotics, right? And so I had overheard my family members talking about a rhinovirus, and rhino means nose. So I was like, so this thing is in my nose, right? He goes, yeah. I go, well, if it's in my nose, it's probably a virus, yeah? He goes, probably. I go, well, then why are you prescribing an antibiotic for my nose? And he said, well, the antibiotic will focus on the bugs in your system, the bacterial bugs, so that your immune system can focus on the virus. I said, okay. Told my mom, she's a dentist, I go, what he said. And he goes, and she says, she came in that genre, that age group where you just did whatever the doctor did. You didn't question it. And so I took it. I got better. You can probably guess, you'll find out soon enough that I was a nerd. And I went into the library. This is pre-internet. And I looked it up, and sure enough, you don't prescribe. Even in 1991, I think it was. We knew then that you don't prescribe antibiotics on
Virus.
Someone that is that has a viral infection. Yeah, you can develop an adaptation to the penicillin, and it may not work when you need it. So, honest to God, my first thought was, these people don't know what the hell they're doing, meaning physicians. That was my honest to goodness thought.
How old?
Just 18. I'm like, these people don't know what the hell they're doing. So I kind of gave up on it, and I was also doing martial arts. I was doing Shaolin. And the instructor was a dental technician in the army, and he knew I wanted to be a dentist. And he's like, David, you should look into Chinese medicine. I think you'd like that. I said, okay. So, and I wanted to study it, not because I wanted to practice it, but because I wanted, like, when I have my own family, I wanted to treat them with something holistic.
Right.
So I went into dental school, loved it. Not a fan of the East Coast, but I love the school and the training. And then I came back to LA, and immediately studied, got my master's in Chinese medicine. Yeah.
Wow.
And then after that, I got a master's in psychology, spiritual psychology specifically. Loved it. And throughout the whole time, I was doing about 200 hours a year in CE, in the dentistry part, right?
My word.
So here's the thing. When I got out of dental school, I was 7 to 10 years behind the technology, right? Like even with like something that's like old as root canals, like, you know, they taught us how to do it manually, right? They don't do that anymore.
Right.
I mean, even in 2000, which is when I graduated dental school, they had rotary instruments, they had ultrasonic tools, they have ozone, they have all these techniques, and they don't teach you that. You know,
Wow.
there was a lot of things. So, but I'm so passionate about it. To me, it was really exciting, right? And when I opened up my practice here 16 years ago, and I distinctly remember I would put up my lectures slides, and I would put down the DDS, the acupuncture, the masters, all of that. And people would say, "Oh my God, you're so young." And I would say, "Oh, I'm not married." And the whole room would go, "Oh," right?
That's why you have
And I
all
didn't
the
have a
time.
house yet, so I needed a tax deduction. So CEs were a great way of traveling, which I love, and learning new things and
Mhm.
getting a tax deduction that I so desperately needed.
Right.
So it was great for me. I loved it. And then it was in doing the orthodontics, that the functional orthodontics, that I got into TMJ, right? You know, patients would come in with their kids, kind of like you. They would come in with their kids, and we would do, like, they had ADD. Like, we didn't know that ADD and ADHD back then was caused by sleep apnea. We didn't know about that, right? Now we have well over 2,000 studies. Like, it's not even a consideration, right?
Mhm.
And one very prominent researcher, Dr. David Gozal, who's a pediatrician and a sleep specialist, him alone, he's done a few thousand studies on the subject.
Wow.
And he said that kids with sleep apnea, their inflammatory markers are so over the top,
Mhm.
that he said, if you do a blood test and if their TNF alpha is over 2,000, okay, he goes, you don't even need a sleep study. That kid has sleep apnea. It's pretty much guaranteed,
Wow.
right? So we would do palatal expansion. I like the Alpha appliance, but it's a cranial device
Mhm.
that actually expands the palate simultaneously. Yeah,
Wow.
very gentle. I actually have like more. I'm like 2/3 adults and 1/3 kids. So
Wow.
it seems more adults come see me for it than kids. But now we didn't know this back then, but now we know that functional orthodontics with palatal expansion is more successful in children with sleep apnea than both CPAP and surgery,
Wow.
even in obese kids, even with enlarged tonsils.
Wow. So naturally, every dentist and pediatrician is referring out for this, right?
Right. In, I think it was 2015, the American Academy of Pediatrics said, we recommend our pediatricians to ask if the child snores or gasps, and then refer out for a sleep study if they do. They still don't, by and large,
Right.
but they should. And
Right.
there is not one aspect of a child's life other than their genetics that it doesn't affect.
Yeah.
Every physiological, structural, organ-like, and behavior is related to their sleep.
I believe it 100%. You know, we didn't have this conversation, but we just started offering microcurrent neurofeedback in the office, specifically
Beautiful.
that's targeting the delta wave, which is what
Beautiful.
should be working when you're sleeping and recovering and causing metabolic clearance and all that stuff. And we're finding all these people coming in, and their delta wave is almost imperceptible how abnormally low it is,
Are
which
you
means that
measuring it when they're sleeping?
we're not. No, this is just like chill. Like,
Yeah, we're not really supposed to be in delta when we're in chill.
yeah,
We get predominantly delta during like stage 4
yeah.
sleep.
Well, not measuring in the sense of like full like EEG, we're like, we can see all the waves. And the delta wave is just like not necessarily like dominant, but slow. Like it's like it should have a certain frequency, but it's just not, it's below the normal frequency of what it should have. Does that make sense?
Okay. Yeah, I'm hearing you.
Yeah.
We get almost 100% of our growth hormone from delta wave sleep.
Wow.
Almost 100%, over 90% of growth hormones, HGH, comes from delta wave sleep. And so whenever we have an arousal is when we're kicked out of delta or REM for 10 seconds or longer, right? I mean, that can happen from a noisy neighbor's dog, for example, right? But it most often seems to happen from sleep apnea and snoring.
Wow.
Right.
Wow.
And so that has been like the segue to, like, we know half the time the reason why we clench is because of something to do with sleep apnea, what we call upper airway resistance syndrome.
Wow.
Yeah.
Wow.
And children are very sensitive to sleep apnea. So for example, it's considered for an adult white male, if they have 5 apneic episodes an hour or less, is within normal limits. Okay. If a small child has 3 an hour, that's severe.
Wow.
Right. The reason being is, in adults, it kind of breaks down to 25% for each stage 1, 2, and 3 in REM. When we're born, we have pretty much only REM and delta. Right. And then as we get older, we get more and more stage 1 and 2 that creeps in and eventually takes up 50% of our sleep time. But because small children have very high REM and delta compared to adults, each arousal they have is much more detrimental for that growth hormone and for that REM.
Yeah. Wow.
Yeah. So
Now I'm seeing, and this is kind of, I didn't prepare you for this question, but I'm sure you get it all the time.
You didn't prepare me for anything.
That's true, actually. Yeah. We still have more of your story to get into, I'm sure. But as a pediatric chiropractor, we're seeing, babies. We all see the mom through their pregnancy, and then we'll see the babies as soon as we can after the baby's born. And I've been doing this for 7 years. The past 1.5 to 2 years, I am seeing a exponential amount of ties, lip, tongue, buccal. All of them are being super tied up. And I'm noticing too now, even feeling the palate and the tongue movement of my older kids, 3 and 5 years old, that a lot of their palates are actually, you can feel them like collapsed, either on the front or the mainly in the back, from ties that never got checked out. How does that play into kind of like the development of the palate, and is that kind of maybe even a precursor to the things that you're seeing now, where the tongue couldn't push up and extend the palate on its own? Now you're having to more manually do it later in life.
Yeah. So it really got started with the breastfeeding, right? When people's focus was to breastfeed, right? And I should back up. Prior to the Industrial Revolution, people had relatively straight teeth and wide palates and nicely developed jaws. Okay. And we see this because we have, 10,000 years plus worth of skulls, right? And I mean, if you think about it, 3 to 5 years, that doesn't mean that when their teeth erupted, they didn't start chewing food. They did. But I mean, mom's breast milk is the best food there is, period. 80% of a child's immune system comes from the gut. And here is, this delicious elixir of fat and enzymes and probiotics for the gut, for the child's immune system. And it only lasted 2 weeks. The first year of a child's life, if the mom stopped breastfeeding, 2 weeks later, their immune system would suffer. Right? So when we as a culture would breastfeed regularly, it became that much more focused on a tongue tie. We would just say, oh, okay, well, we have a tongue tie. Okay, well, they're not creating a seal or they're not suckling. Let's check for the tongue tie. There it is. What were they called? They had a term. Right now they call them lactation specialists, but back then they called them like midwives or
Oh,
something
yeah.
like that. And they would have like a really sharp pinky
Yeah.
nail, and they would just, cut that
Uh-huh.
thing. Baby wouldn't cry. They would then be able to suckle. And then just the physical act of suckling would stretch out those fibers, right? There are some theories that a folic acid excess or deficiency is what's leading to these tongue ties. I don't know. It's so hard to tell. I mean,
Yeah.
how do you measure such a thing?
Can't.
But the one of the reasons, probably the number one reason why we're seeing crowded dentition in the modern industrial world is by breastfeeding. The child is learning how to swallow on the palate, lift the tongue up against the palate, which expands the palate. The palate has to be the shape of the tongue. And their bones are nice and soft, and they adapt. When we switch to bottle feeding, we now keep the tongue down in the mandible, and we use our cheek muscles, our buccinators, and the suckling action, like this, actually collapses the arch.
Wow.
Right? And they usually get more milk from a bottle than they do a nipple, right? So now they're being rewarded by using a buccinator with these bottles. So it's a problem. But I'll tell you what, my wife breastfed for nearly 2 years, and I still recommended expansion on my son.
Wow.
Yeah.
Wow. So what does that look like? A little bit of a tangent, but what does that look like for a kid, at 2? Or is that how early you did it, or did you wait, or?
We did it immediately. We did.
So what does that look like?
So for us, it was basically a pair of scissors and, a snip, and that was it.
Okay. So it's not like a device that you're putting in to expand. You just did the.
I'm sorry. I thought you were talking about the frenectomy.
Oh, so no. Yeah.
What we did is we put an alpha appliance inside, his mouth, and then we activate it about once a month. And then we work with doctors like yourself that do the cranial work to facilitate the rest of the body. Does that make sense?
Yeah. It's amazing. I mean, I just did a podcast with a gal that got super passionate about she had her kid had ADHD and asthma, or two kids, one had the other.
Okay.
Did the frenectomy and changed their life completely. All starting in the mouth. And then there's another, I don't know the doctor's name, but he's a dentist. And the big talk right now is like the gut brain connection, right?
Yes.
And he wrote a book called the mouth brain connection. It's just like all this focus on what's going on up here, and we've really isolated the mouth and the face to just being aesthetics and chewing, like not really related to the overall well-being of our body. Where do you think we lost that?
Goodness, I don't know.
Because as an acupuncturist in Oriental medicine, the first thing you do is look at somebody's tongue, I'm assuming, right?
Yeah, that's very true. Well, I mean, we could go down the rabbit hole.
I don't big pharma, big ag, and big government.
Well, I mean, one of the things I had 2 big questions in life, and I thought that they overlapped. So, like, especially countries like England, where the average, and the Dutch countries, the average person is pretty cheap, right? They want to save as much money as possible. Yeah. And here you got this nice free boob, right? And they also, it's not just like, you're not just feeding the child. There is emotional bonds being formed between the mother and the child. So it's a really beautiful event that's done on a regular basis. My wife, when my son was born, I was like, honey, could you just please, breastfeed for at least a year? There's a huge amount of benefits. And my wife's a pharmacist. She was ready to go back to work.
Wow.
And she's like, really? A whole year? I go, I'm just saying it's what's best for the kid. You do what's, best for you. But I'm just letting you know. And she, and her thought was, okay, well, I'm going to do it because this is what's best for the kid. And she loved it. And so when the 11-month mark came, I go, honey, it would be really great if you breastfed for 2 years. She was like, no problem.
Right.
She loved it. Another question I had, because I couldn't understand, how could they convince cheap people to give up this free, wonderful boob and make them go on a soy-based, powder-based fake food for their kid? Right. I didn't understand it.
Right.
The other thing I couldn't understand was my nature. I guess I maybe I'm a pacifist, but I'm very anti-war, and because most of the time wars are bullshit, and they're basically people have been propagandized to believe there's some imaginary enemy, and you have to like somehow give up your kids to go to war to help the king or help the government or help do whatever. So one of the things I couldn't understand is as people got older and they realized, yeah, we're being played. We're being like, thrown to the wolves just to better, a few people, right? I think the thing that came to my mind was, well, if you no longer are breastfeeding that child and you switch him to a bottle, maybe you're severing some of that connection.
Yeah.
Do you know what I mean? Because now anyone can breastfeed. Now the sibling can breastfeed, the dad can breastfeed, the maid, whoever you have in the house, grandparents. And if you change that connection, then maybe it's that much easier to allow them to go to war when they turn 18.
Interesting.
I don't know. That's just the way my mind works.
Yeah. I mean, that I never would have said anything like that. So that's I mean, not that I have a better answer, but I think that's scary how deep and much forethought somebody could have. You know what I mean? Like if we do this here, that's going to affect them later on down there. And it's, that's a scary thought, to be honest with you.
Well, and also like, traditional medicines, naturopathic medicine, Chinese medicine, they all have a functional approach.
Right.
So they know, there's functional benefits to breastfeeding. There's functional benefits to the oral cavity. I mean, there's all these benefits. Allopathic medicine is, well, whenever the problem comes up, we'll drug it up or we'll do some reductive surgery, for it. It's a mindset difference. So if you don't get if you don't get the probiotics, for example, from that, well, maybe you need some other pharmaceutical to help with your immune system later on. Right. I don't know. What I do know is that the biggest lobby in the world is the military, and the second biggest lobby is pharma.
Yep. I'm sure we could talk about that for a very long time, but we'll just agree that that is a bigger problem than you and I can conquer alone, which is why I'm thankful for collaboration and conversations like this. Why don't we steer the conversation a little bit back to what are some of the things that people seek you out for? Obviously, if they have TMJ or sleep apnea, they're coming to you. What other sort of symptoms and problems are you starting to see nowadays?
So, I mean, just from the day I started, like before I read all the research, patients would come in, let's say their chief complaint was Meniere's disease, for example. And they also had a TMJ problem, and they were sort of resigned to the fact that the Meniere's wasn't going to go away because they've done the steroid, they've done the antivirals, and then we treat them for their TMJ problem, and then their Meniere's goes away. Wow. Right? So we now know that the number 2 cause of ear problems like ear pain, otalgia, fullness, tinnitus, and let's say something like Meniere's are TMJ disorders. Like number 1's infectious and number 2 is TMJ. TMJ disorders, I should say. So, that's a common thing among all ear problems. But so for example, like we know the cause of tension type headaches is when the greater occipital and greater auricular nerves are being pinched between C2 and base of skull, like occiput, right? That's why when you guys do your cervical adjustment, they get instantaneous resolution of their tension headache, right? But then typically they go back, clench their teeth at night, and they're back to square one. Do you know what I mean?
Yeah. Oh, absolutely.
So the overlap between tension headaches, neck, neuralgias, I mean, we just see the overlap.
Yeah. Now, we were talking a little bit pre-recording again about kind of your methodology. I think a lot of people, think you to treat your TMJ, you just wear a mouth guard. That's kind of the common, thing, or get a massage, something like that. You were telling me about some of the manual therapies you do, kind of differentiating between a chronic TMJ or an acute TMJ. Why don't you give people a little bit of a sneak peek? If they have TMJ, what's the process that you take them through? What are the different therapies and techniques that you would use?
So, what's really interesting about TMJ disorders is people don't know that they have them, right? So, and the reason is this, how we have that mechanism in our brain where redundant information is not really relied upon, it's ignored. Yeah. So if you walk into a room that smells really bad, and you stay in the room, after only a couple of minutes, you don't smell it anymore. Right. But those odor molecules are still in the air and getting sucked up into your nose, right? But your brain says that's redundant information that isn't helping us right now. Right. Now, we swallow 2,000 to 3,000 times a day.
Oh, wow.
Every time we do, we put our teeth together. Right. If you have a jaw problem, every time you put your teeth together, you're compressing those nerves and blood vessels, between the condyle, the jawbone and the ear. And then we chew our food, and then we talk, and then we go home and we clench our teeth unconsciously in our sleep. So many people don't even know that what they're doing is coming from the jaw. They get referred from their ENT because they are having ear problems, and no one else can help them. And they finally got a switched on ENT that said, "Oh, you have a TMJ problem. You need to see this guy. I don't see anything wrong with your ears. You need to see this guy."
Wow.
Migraines, for example. So migraines are what we call a centrally sensitized trigeminal disorder, which means central sensitization means you have a chronic repetitive injury that causes plastic changes in the brain. Yeah. And that causes either other parts of your body to hurt, like trigeminal neuralgia, or your body just, misbehaves, right? Which with migraines, we get a unusual vasodilation and vasoconstriction, right? And I'm embarrassed that I have these arguments with physicians, right? But when I tell them that TMJ disorders can potentially cause migraine, they're like, well, migraine is a trigeminal vascular disorder, right? And I go, yes, the blood vessels don't have a mind of their own. They need a nerve to tell them what they do. Do you understand? Like, this is just like I tell my patients about muscles. They go, "Oh, my muscle hurts here, or my trapezius is all, I go, listen, muscles are just meat until the nerve tells them to contract. Right. So I'm more than delighted to teach a patient that. Right. I'm embarrassed to have to explain to a physician that blood vessels don't open and close on their own. That they need a blood vessel, they need a nerve to tell them to. Yeah. So that's what happens so all migraines are essentially sensitized trigeminal disorder, but that could be hormonally triggered. It could be structural. It could be gut, could even be emotional. So we need to kind of assess what's going on with the patient so that we can offer our support.
It's amazing. And now, somebody comes in, with a pretty typical, TMJ presentation. What type of techniques are you employing? We're talking a little bit about SOT or cranial sacral, or some of these other manual therapies. What does a treatment plan typically look like?
So a great question. So as you know, I'm very functional in my origin. So number one thing is their clenching of their teeth. That to me is like a big portion of it, because if you don't stop that, nothing you do will work, right? I call it peeing on a fire. It's not going to do anything. Now, the problem with traditional night guards is that they're designed to protect the teeth and the dentistry. Okay, that's what I was taught. Very few dentists have had any training in TMJ in their office other than basic from school, other than basic anatomy.
That makes no sense.
You would think so. The only people that have had training, in my experience, are oral surgeons,
Uh-huh.
some physical therapists, and some chiropractors. That's like that. And then, unless it's acute, it's not going to work,
Right.
right? As we talked about,
Mhm.
off air. So, number one, I want to see if I can reduce their ability to clench 50 to 100%. That's my goal. As we talked about off air, sleep apnea can cause people who with sleep apnea clench about 50% of the time.
Wow.
So we have to look at other markers as well, both systemic and structural, to see if, okay, well, maybe the reason why you have this TMJ problem is because you have sleep apnea and you're
Mhm.
clenching,
Mhm.
right? That's a not uncommon throughway in my office. The other is if they have clicking, popping, locking, limited ability to open their mouth, we're often putting a daytime appliance in as well for a few weeks
Wow.
to try to get the jaw to unlock if we can,
Right.
at the very least, to get them out of pain.
Right.
Because usually they need round the clock protection, and they can't really chew food often because putting their teeth together
Hurts.
puts their jaw in the maximum protruded position. So when they wear a daytime appliance with teeth on it, they can now chew with that without hurting their jaw. Does that make sense?
Wow. Yeah. Yeah. Yeah.
Mhm.
It's amazing, and not to diminish the work that you do, but it's relatively simple. Like, you got muscles that are tight, you got nerves that are spasming, you got a nervous system that's overwhelmed.
Mhm.
Let's treat that instead of just, trying to do Botox here or like this and that there. It's like it really kind of scary when you look at like how not not easy to do, but simple the mindset is of treating something like this and being open and aware. It's like, they're actually a sleeping problem. Let's look at sleep. Like, what I mean? Let's fix this. And it's just like, it's not hard to connect the dots, I guess is what I'm trying to say. And it's
Yeah.
scary that it takes someone like you with a inquisitive and curious mind to find it out on your own, rather than saying, hey, this is what people are doing out there successful when you're in school.
Right.
Take this track if you want to, learn how to really fix it or something like that.
Yeah, exactly.
Yeah.
Exactly.
Well, thank you so much for the work that you do, not just prescribing medications and not just, saying, I hope this works, go ahead and go out, because there's a lot of, and pain is not just something that you feel. Like, it starts to affect your being. You start to identify it as it, and it starts to run your life instead of you being free to do the things that you choose. And I'm sure that you've heard stories of many people living a life that's not good, addicted to medications, or taking their own life because of the amount of pain, especially a trigeminal neuralgia or Meniere's,
Yeah.
or those sort of things. And so thank you for being willing to step outside the box and see these people for their issues, and listening to them, and getting to them for the root cause, and for being willing to come on a podcast like this and speak your truth, speak your mind, to get the word out there that there are people that can help with these issues and fix
Absolutely.
them for good, not just cover up the symptoms.
That's right. Thank you so much for mentioning that. We do the best we can at all times, all of us. Yeah.
Right.
And I'm always learning. I've had patients that, I only got about 50 or 70% of their pain gone. Then they'll come back for like a recall and they'll say, you know what? I did this one thing. I took this supplement, or I saw this one practitioner and he did this, and that changed everything for me. And I'm all over it. I'm like,
Right.
tell me more.
Right.
Okay. You know, and then I get the ability, I always say it's like a toolbox, and the more tools you have in your toolbox, the more you're able to get the job done.
Absolutely. Well, if
Yeah.
people are interested in learning more about you or the centers that you work at, to see if maybe there's one closest to them,
Mhm.
where can they find out more? Where can they listen to your podcast and things like that?
Yeah. Come on to my website, TMJ LA, pretty easy to remember.
Yep.
TMJ Conejo is the same website. But just to kind of remind people, I have a second office in Conejo
Okay.
Valley. And yeah, I mean, you can find it. Oh, if you go online, if you go to YouTube, I did a Google Talk, and I have a bunch of videos where I explain things.
Awesome. Cool.
Yeah.
Well, Dr. Dave, thank you once again for coming on the show. I know there's somebody out there that's going to be listening to it, that's going to share it with their friend or family or aunt, or, someone that's been struggling with this, and it's going to change their life. So thank you for doing
I
this with me.
sincerely hope so. I sincerely hope so. Wonderful speaking with you, and I hope we stay in touch.
Awesome. Yep. Thank you. Me too.
Thank you for listening to the Healthy Perspective Podcast. To connect with Dr. Bowman, follow him on Instagram at Dr. Chris Bowman. Until next time, make shift happen.